I think that we could hinder a lot of the transmission if we kept the pigs in the same litter and accepted that the sizes are not completely equal. But maybe it will benefit them anyway because they will not get the same amount of pathogens circulating.
Hello, welcome to this Meet the Expert podcast on swine health management in practice, brought to you by Boehringer Ingelheim. My name is Peter Best. In this podcast, we continue a conversation with Dr. Pia Ryt-Hansen in Denmark about Influenza A virus, or IAV. Dr. Ryt-Hansen is a veterinary virologist at the University of Copenhagen who has been making a particular study of the characteristics of IAV in a modern sow herd. What areas of research are opening up that you see that need to be addressed? Because you're talking about a wide range of a spectrum, as I called it. You're talking about possibilities that are being raised, which have real important implications. What research is ongoing, to your knowledge, and what areas need to be researched most actively?
Yeah, we're still looking into the evolution of the virus in the individual herds. So as I said, I only performed this study in a few sow herds, so it needs to be confirmed on a greater scale as well. And we need to understand also what makes these influenza viruses zoonotic to people. It's also an important area, and actually we just got a new research project looking into that, so we can understand which of these swine viruses are actually a danger to causing the next pandemic.
Yeah. Now, for the second part of our conversation, then, please, I'd like to concentrate on the practical lessons for herd health management and on the pig side. Specifically those that have come from your own research. To start with, have the dynamics, transmission dynamics of IAV and sow herds, if they changed have they changed in recent years in a particular way, would you say?
Yeah, so definitely they have changed the last 10 years. As the herds have gotten bigger, we've seen that the virus persists within the herd and are infecting pigs all year round, as we mentioned earlier. And we also looked into the effect of these maternally derived antibodies, which we have now seen that the protection that you obtain through these maternally derived antibodies are not complete. And they can actually maybe enhance the level of viral persistence over time in the herd.
That's interesting. And again, I'm trying to think how to respond to that in practice. What would I do to adapt to that question? Let's move on and come back, if I may, on that one. At what age or stage do pigs become infected, and what do you think is the reason for the infection occurring at that stage?
Well, actually, we've seen that piglets of only 3 days of age can become infected, and they can become infected even if they are positive for these maternally derived antibodies. So it starts as soon as they are born. Of course, it takes some incubation period before the piglets start shedding the virus, and that's why they're probably 3 days of age and not completely newborn, but it starts already in the farrowing unit. And you need to realize that to be able to control the disease, because previously it was mostly believed to be a problem when the pigs are moved into the nursery. But actually it's a problem that you bring along from the farrowing unit into the nursery. So the control focus should be already at the farrowing unit.
The transmission is occurring from one litter to another in the farrowing unit?
It is indeed, and I think that's also part of the way that we manage the swine herds nowadays, because we are trying the best we can to equalize the litters based on size, and that is not very good from a pathogen perspective, let's say, because we're actually enhancing the spread of all, not just influenza, but all different kinds of pathogens between the litters. And the same when we are weaning them into the nursery, the farmer also seems to want to mix them into these pens where they are more or less the same size, instead of moving them litter-wise. And I think that we could hinder a lot of the transmission if we kept the pigs in the same litter and accepted that the sizes are not completely equal. But maybe it will benefit them anyway, because they will not get the same amount of pathogens circulating.
But okay, in the farrowing unit, if I may just ask one follow-up question on that, I assume that an IAV positive sow also has an IAV positive litter?
Yes, that's actually one of the things we looked into. So we wanted to also sample the sows, because previously mostly been looking at the piglets, and we found a good correlation between the litter being positive and the sow being positive at the same time. But we don't exactly know the directionality, so which way is the transmission going?
You think it might be piglet to sow? Oh.
It could also be. So if the sows are not properly immunized before they are put into the farrowing unit, where we know that there is a large circulation of influenza, then they are at really high risk of getting infected just 1 week before farrowing, which is probably the worst time to get infected, because they need to be at their best when they need to farrow and start milking. So we could really do a big change, I think, there, if they are properly immunized before moving into the farrowing unit.
Sure. So we've got to be looking both at gilt introduction, as you said earlier, and about what we're doing with the sows in terms of making them immunized when they arrive.
Yes. Yeah, and I think the gilt part is also, it needs to be emphasized, because those are some of the only animals that are coming into the sow herds are the gilts. And if we don't have a proper quarantine, where we also include at least 2 vaccinations, then they can either bring in a novel subtype, or they will come in the herd completely naive and thereby contribute to the whole transmission dynamic in the herd. So those are some very important animals to look into.
I see. It sounds to me like many of these things could apply to other viruses as well, but IAV is a good marker for that.
Definitely, yeah. And you should remember that IAV is part of the Porcine Respiratory Disease Complex. So if you limit the transmission of one of them, the clinical signs will also be less.
Okay, so we need all in, all out in the farrowing unit. We need well-protected sows when they arrive, and gilts to receive that attention, and pig flow, I suppose we've got to be very much aware of that, and age groups and litter groups, as you've mentioned, would all help to do it. Does that mean that you've identified particular parts of the swine population in a sow herd as playing a key role in the herd level persistence of IAV that you're now describing?
Yeah, the piglets are actually, I guess they would be the key role in transmitting the virus further on. And also the sows, because they are the ones who are staying inside the herd the longest and are transferred among the production system. So those, yeah, you need to look into both of them.
Now, I should have asked you again a very detailed question. You talked about the grouping of pigs, the litter grouping. What do you do with sick pigs is a practical question. Do you have hospital pens, and how good or bad is that in an IAV context?
Well, I think that that is a very good question, and I think you need to look into how you handle the sick pigs, because most herds, I guess, at least in Denmark, they are making these sick pens, and it's becoming very difficult, because how can you introduce these pigs from the sick pens back into the herd without also transmitting disease into the healthy litters? So I think the more you can avoid transferring the pigs into a sick pen, the better. So try to treat them in the pen that they originate from, and only if they are very sick, then you need to take them out, of course.
Thank you for those points. Now, you mentioned maternally derived antibodies earlier. Would you just go back on that? What is the role of MDAs in piglets according to your experience with IAV?
Yeah, so MDAs are, of course, antibodies transferred from the sows to the piglet, and it's something that I guess, at least in Denmark, the vaccine is mainly used for sows to stimulate the production of antibodies to be transferred to the piglets, so we can protect them in the farrowing unit. However, in our studies, we've seen that you need to consider, or to get an optimal protection of these maternally derived antibodies in the piglet, you need to have a certain level of the maternally derived antibodies, but also the homology between what the virus the antibodies are directed against compared to the circulating strain is very important for how efficient they are. So we have seen that the MDAs can protect the piglets at least the first 3 weeks of life, but then they will start getting infected again. And also, if you have a pig that become infected during the presence of MDAs, it actually shed virus for a longer time, and that can increase the herd level persistence.
So the shedding increases with it.
The shedding time increases, not the virus titer.
Sorry, not the load, not the load, the time. Yes, thank you. I understand that. So we talked about vaccination. Have there been any changes about where and when to vaccinate as a result of your research?
Well, at least we have tried to emphasize to the veterinarians that they really need to adjust the expectation and make a plan with the farmer when they begin, because when you use inactivated vaccines, as we do in Europe, you cannot expect sterilizing immunity. So the disease or the virus will not go away when you start vaccinating. So if you make the farmer believe that, he will be pretty disappointed. So the vaccine mainly has a claim on the clinical signs and reducing the spread of virus to the lungs. So that is what you should also measure if you want to see the effect of the vaccine. So you should actually, maybe with a coughing index, compare before and after vaccination instead of measuring virus.
Yes. What about the choice of vaccine? Your findings about the so-called drift of IAV surely make us question using the same IAV vaccines for years.
Yes, but so far in Europe, it's our only option. We only have very few vaccines available. In Denmark, only 2 different. So that's what we have to work with. And as I said, we also need studies to see how much this genetic drift are actually impacting the vaccine, because we know using these adjuvants, we can have a broader immune response. But I think it's pretty spectacular that we have 20-year-old strains that are genetically very different to the ones we have circulating now.
And bearing in mind the field veterinarians listening to this podcast, Pia, you've used sequencing to identify strains and so on. Would you say that sequencing is now to be recommended to as a standard procedure almost in herds, so that you get a better picture of the development of disease and infection?
I think definitely sequencing can be used as a tool for the herd veterinarian to become wiser on what is going on in the herd and understanding the transmission dynamics. So it would be optimal if you had a kind of ongoing identification of the herd strain and see how it changes over time. So it could help explain if you all of a sudden feel like your vaccine is not working, or if you're experiencing an acute outbreak of respiratory disease, we would be able to go in and see if the herd strain has changed or actually a novel strain has come in. So I think now that it's becoming cheaper to do this sequencing, it could and should be used as an additional diagnostic tool. And it will also help us researchers to get much wiser on what is going on.
But are you saying have it done routinely even when there isn't a particular episode that would prompt you to do this, or would you wait for something to happen and then use sequencing to investigate it?
I think that if you don't have it continuously, you cannot tell the whole story, I guess. So it would be most optimal to have a continuous surveillance in the herds.
Would you? How frequent and how do you do it? Very quickly, please.
Well, optimally it would be once a month, but I guess it could also be, it depends on the herd, but what they are up to. But I think that would be optimal.
And you get the results quickly enough these days to be able to use this in your investigation quite quickly.
Yeah, so nowadays it only takes maybe 3 days before we have a full genome of the herd strain.
Yes. And you mentioned coughing. We've had an earlier podcast in our Meet the Experts series where we spoke to Dr. Greg Stevenson in America about the monitoring of coughing in pigs as a guide to different respiratory diseases, including influenza. Your particular studies have included then a cough index or some assessment of coughing. Is that right?
It is, yeah. We calculated a coughing index in the litters that we sampled, and we found a correlation to influenza being present. I should just mention that for influenza, at least when we look at the very young pig, it is important that it's a coughing sneezing index, because they actually sneeze more than they cough. It's more the older pigs that are coughing. And also we looked at individual clinical signs, and also nasal discharge is also correlated with the finding of influenza in the individual pig.
So there's a correlation, and that's correlation with individual pigs, did you say, or with pens or litters or whatever? What was that correlation again, please?
Yeah, so we see that the positive litters will have a higher coughing index, and on the individual level, we can see that if we have a pig with nasal discharge, then it is more likely to also shed influenza at the same time.
Oh, right. So certainly, a coughing monitor would be a helpful tool in identifying IAV positive pigs for diagnostic reasons. So.
It definitely could be a tool used to choose which pig to sample for the diagnostic. Yeah.
Yeah. So thank you very much, Pia. And let's go back to your basic message about the year-round infection that is now IAV. It's not seasonal, and that we should be aware that how we practice our management systems on the farm have a big influence on its persistence. And there are certain measures that we can take which would help us in that situation. And thank you very much then to Dr. Pia Ryt-Hansen for her help in this podcast today about Influenza A virus in pigs. Thank you to our listeners for joining us in this podcast. There will be more podcasts in the Meet the Expert series, but for now, thank you and goodbye.